Thank you for tuning in to Yada Yada. I'm Dr. James. Here we are in 2021 and COVID-19 is still dominating the news cycle. Hopefully, there are better days on the horizon as the COVID-19 vaccine becomes available to the public. Let me give a disclaimer here up front. Deciding to get a vaccine is a personal decision and should be made between you and your doctor. The data I utilized to compile this informative video is from my own professional experience and collection of scientific research. I encourage my patients and encourage you to do your own research. A great place to look for facts and questions and answers to your questions regarding the COVID-19 vaccine is the Center for Disease Control and Prevention website at cdc.gov. COVID-19 vaccine programs have now been rolled out nationwide, and millions of Americans have rolled up their sleeves in the hopes of stopping this dreaded disease. The COVID-19 vaccine is a very hot topic, and I'd like to try to address some concerns. Yes, it's true that the COVID-19 vaccine was developed quickly, but this was in response to a disease that does not discriminate and has made millions of people sick worldwide and has killed hundreds of thousands of Americans so far. The vaccine was developed under strict ethical and scientific guidelines, utilizing thousands of human test subjects over a period of several months and during several different trial phases. Currently in the United States, the Food and Drug Administration has granted emergency use of 2 vaccines thus far, the Pfizer, BioNTech, and the Moderna vaccines. Several more COVID-19 vaccines are under later stage trials in the United States and are awaiting approval for use. The vaccine has already been made available to healthcare workers, first responders, nursing home residents and workers, public servants, and in some states, public school teachers. Currently in my home state, individuals aged 70 and over are now able to receive the vaccine. Your local state health department agency website should have all the information you need in order to inform yourself when you may be able to get the vaccine. So let's talk about the efficacy of the vaccines. It has been reported to be more than 90% effective if given as directed, that is, in 2 doses separated at least by 21 days in Pfizer's case and at least 28 days in Moderna's case. And just as a reference, over 90% efficacy for a vaccine is very exciting. If you have had a vaccine for anything else recently, you should wait 14 days before receiving the COVID-19 vaccine, and then wait for 14 days after you receive the second dose of the vaccine to get any other vaccine. Currently, the only listed contraindications, meaning circumstances or conditions that would pose a risk to vaccine administration for the COVID-19 vaccine, is if you are allergic to any of the components of the vaccine. If you have any questions about whether or not you should receive the vaccine, speak with your doctor. The COVID-19 vaccine is only currently approved for use in individuals aged 16 and older, and there are plans to start enrolling younger children in the vaccine trial soon. If you have recently been infected with COVID-19, the instructions are that you may want to wait 90 days to get the vaccine, as reinfection within the first 90 days is less likely. However, if you've received monoclonal antibody treatment or convalescent plasma for treatment for COVID, you really need to wait the full 90 days prior to getting vaccinated. Personally, I had the disease in November, and after I recovered, I did get my first vaccine in December and my second dose of the vaccine in January. Side effects from the vaccine are pretty typical for any vaccine. As your body mounts that immune response, you can feel a little flu-like. I did get a headache, body aches, and fatigue from the first vaccine, but the second vaccine I fared much better. One question I routinely get from patients regarding the COVID-19 vaccine is, can the COVID vaccine give me COVID? The answer to this is a resounding no, it cannot. This particular vaccine, speaking about both the Moderna and the Pfizer BioNTech vaccines, utilize an mRNA vaccine technique. It introduces a packet of instructions, if you will, that helps your immune system to build the unique viral spike protein that your immune cells present, and your body will make antibodies to that unique protein. None of these components can give you the virus. No virus is introduced into your body with any of the COVID-19 vaccines. The vaccines have been proven to be safe and effective. I have encouraged all of my patients that are over the age of 16 to get the vaccine when it becomes available to them. Again, there may be some seldom exceptions. As I said before, vaccination is a personal choice. There are always unknowns and there are always risks. I feel confident recommending it to my patients, but encourage them to make the decision for themselves. Thanks for tuning in. Stay informed and stay safe.